Hi, I'm Heather French Henry, the host of Heart of Gold, a monthly program whose mission is to highlight examples of what makes Louisville, Kentucky the most compassionate city in the world, as declared by Mayor Greg Fischer. This series features local nonprofit organizations of all shapes and sizes, which are working to improve the quality of life for all Louisville citizens. Thank you so much for joining us, and a special thanks to WHAS TV for generously producing this series. This segment features the Family Community Clinic. Inspired by the social concerns of St. Joseph Parish, the Family Community Clinic opened in 2011 to serve free of charge families, children, and individuals without medical insurance. Staffed by an all-volunteer medical staff, the clinic provides essential health care for citizens and immigrants in our community who are uninsured. Funded solely through the generosity of private donors and foundations, volunteers have logged over 10,000 hours of service, provided care valued at over $750,000, and in 2015 saw its 4,000th patient. 4,000 patients. Now, this is Becky Montague, the executive director of the program. 4,000 patients. What does it feel like to serve your 4,000th patient?
Well, we've gone even past that at this point. So, we're quickly approaching our 5,000th patient. It feels wonderful. It feels wonderful to know that 5,000 people in the Louisville community are better because of our volunteers in our clinic.
Because without your clinic, those 5,000 patients would not have been seen at all.
It's quite possible that they would have deferred medical care because of the high cost. They could have put off medical care for a condition that exacerbated to the point they had to go to the emergency room, and then they would have had extraordinary bills from an emergency room without health insurance.
Tell me how long you've been there and what you feel like this clinic provides to the community, even more so than medical care.
Well, the clinic, one of our volunteers, Dr. Rick McShane, said it beautifully in a video that was produced for us. So when he said, the Family Community Clinic is a model for possibilities. So we bring together people who want to give their time, that's our beautiful waiting room, want to give their time and their expertise to those that may not otherwise have access. And then it brings to our community an opportunity for someone. We remove all the barriers to health care. Cost is not a factor. We don't charge our patients. You come as a walk-in. An appointment is not necessary, and you have access to a physician or an NP to help address whatever is concerning you with your health.
What types of health care do you offer? Do you have specialty cares, general health care? So
the idea when the clinic opened was that we would work with families that needed to get back to work, if you will. They got sick, they got a cold, they got an ear infection, allergies in the Ohio Valley, and the idea was we were going to get you well and get you back to work. Well, we learned after several years that our patients also had a lot of chronic conditions, diabetes, hypertension, and they needed care as well. So as the clinic grew, so did our scope of practice. We moved beyond episodic illnesses into management of some chronic conditions.
Well, it looks like in that video you're a state-of-the-art facility. So where is this state-of-the-art facility located?
Well, we're a well-kept secret at St. Joseph's Church in Butchertown. We rent space in the basement of their church office. And, it's a bright, beautiful place. It's as nice as any doctor's office, certainly, that I'm fortunate enough to go to. So we were fortunate. We were donated. The equipment that we have in our clinic was donated from a clinic in Park City, Utah. It's of the same model. So, the United States has a rich history of free and charitable healthcare clinics. There's actually about 1,200 across the nation. And the People's Health Clinic in Park City, Utah, knew that we were starting to put together a plan about 5 years ago. So Louisville, the most compassionate city in the nation, would have a free and charitable healthcare clinic. And they said, we're getting ready to get some new equipment. If you can get a truck out here, we'd be glad. So they stocked that beautiful clinic for us. And we have every piece of equipment that you would have in a doctor's office. So.
Wow. Well, that came from one side of the country to the other, that's for sure. When we talk about people who are uninsured, I know a question will come up. Didn't the Affordable Care Act provide coverage for everyone? So tell us a little bit about
and that's a great
challenges.
question, and we get that a lot. So the Affordable Care Act, which really came into the healthcare community in about 2013, sometime before that, but it was a game changer for healthcare, particularly in Kentucky. We had the foresight to expand the Medicaid program, so the numbers of uninsured in Kentucky dropped drastically. However, the Affordable Care Act never really was intended to be a universal health care coverage, if you will. It wasn't intended to be a single payer system. So without universal coverage, you're still going to have adults, children, older adults that really fall through the cracks. They don't qualify for Medicaid. They're outside of the income guidelines. They may not qualify for assistance on a commercial program or commercial product. So we're there to help catch those patients.
Okay, now tell us a little bit about those who remain uninsured. You know, are they United States citizens? Are they immigrants? I know in the Highlands we have several refugee programs there. What's the population like of those
all of
uninsured?
the above.
Okay.
Really, all of the above. So we do see a large percentage of immigrants that are here working, contributing to our community, paying taxes, participating in our economy. But again, they're just not eligible for any type of coverage through the Affordable Care Act, given their status at that point. People transitioning between jobs, you know, people become unemployed, they lose their benefits, may have a waiting period before they're eligible for coverage through another employer. So again, we're there to catch those patients. People new to our city. You know, for instance, if I'm a mom and I'm moving to Louisville and I have children that may qualify for a state-funded healthcare program for my child, I'm still going to have 30 or 40 days to get that paperwork in place, to get that appointment, to go ahead and get the children enrolled in that program. But in the meantime, I need to get them in school. And so in school needs to know that the child is healthy and well, and absolutely, and that they're ready to go. So again, those are the kids we catch, and we're glad to do it.
Well, and talking about the kids too, I know we had seen several pictures of some of the kids in the clinic. So do you take them from infancy through all different ages?
We do. We see all ages. Of course, we love when the little ones come in. Nothing lights up a clinic like a really precious child. So we enjoy to see the children and our younger patients, but we see patients of all ages.
Tell us, in the ever-growing need in this population, as you said, you've reached 4,000, now you're over 5,000. How do you respond to that kind of growth?
It's tough. So when the clinic opened in 2011, we were a Saturday-only clinic. We were open from 8 to noon on Saturdays. I joined the clinic as the first paid ED, executive director, in 2013, and the board handed me a plan and said, we'd like to get to 5 days in 5 years. Well, we did it in 2.5. I mean, the need was so great. We were in a position where we were having to turn patients away. We, as a board, discussed and said, if we can recruit the volunteers to staff the clinic, can we fast track our openings? So today we're open 20 hours a week, Monday through Thursday, from 5 to 9 in the evenings, and Saturday mornings from 8 to noon. And our board has gone back together to say, what's the plan for the next 3 years? Obviously, the need is there. How can we serve more patients? So we'll start to look at what do our hours look like in the future, and are there more hours?
Well, and speaking of community, so the more that you need and you want to grow, how can the community be supportive? How does the community respond to that?
Wonderfully. Louisville never disappoints.
Oh, great. Well, that's good to hear.
They never disappoint. You know, and we find our volunteers are our best recruiters. You know, they come in, they enjoy the culture of the clinic, the community, the atmosphere, and they enjoy the patients and the ability to spend time with patients and really help that patient work through what could be a health crisis in their life. And once they get there and they love the family community clinic, they want to bring their colleagues to volunteer with them. So we have volunteers that are medical, and we have volunteers that are non-medical as well too. So when the clinic is open, I always have someone at the front desk for the clinic helping folks get signed in, logged into our electronic medical record. That's always a volunteer. We have volunteers who are interpreters. So if someone comes in a language that isn't English, we have an interpreter there to assist with that dialogue and make sure that we can address their needs. And then, of course, we have our medical volunteers.
How do you get the medical volunteers? Is this something, do you go through University Hospital, Norton Baptist? I mean, who volunteers medically?
Right. Many, all of the above. Again, our volunteers are our best recruiters, so our physicians and nurse practitioners that are volunteering say to their colleagues, those that they practice with, you know, I'm having this wonderful experience. They've asked me to commit to 1 clinic session a month. I enjoy it. I think you should come with me. So, and our volunteers rush in. You know, we are open from 5 to 9 in the evening, and so many of them have spent a day in the office taking care of patients, and then they come to the clinic to see more patients. We also have retired, and I do want to give a great shout out to our retired volunteers that still keep their license active, but you know, they've left that daily business of full-time work, but they want to stay active in medicine, and we provide that opportunity for them.
What about your supplies? Is this something that the community at large donates? Do you have companies that donate this?
We purchase medical supplies, and so everything we use in the clinic really has to be non-expired. It has to be appropriate for a medical setting. So we do purchase supplies and we fundraise for those. And we write for grants for those.
Okay, so when the community wants to get involved, let's say someone who's non-medical, but we want to be involved, maybe not even in a volunteer capacity, what can you use from us? Money, I'm sure.
Always, certainly.
Always,
yes.
Certainly a given. On your fundraisers, do you partner with local organizations to help you do that? Tell us how, give a call to action to the community out there.
What I would encourage, certainly individuals, let's say individuals that want to support, that they appreciate in their life the good health that they have, the access to doctors and hospitals, and that money isn't, if I hurt, I know I can go to the doctor and I'll work everything else out. So for those individuals that really have a heart and an appreciation for what that means to them, they're welcome to, of course, donations are always important. We know that for less than $70, we will see patients and provide all of the medicine that they need, the radiology that they need, the lab work that they need. So that's a pretty remarkable cost per patient. Yeah,
it's pretty remarkable.
And again, it's just the generosity of others that make that happen. If they want to participate during clinic time, again, they just need to reach out and let us know in what role. If they're a physician or an MP and they'd like to bring that specialty to us, they just need to reach out to us, access us through our website. That's always a great way to do it.
Becky, thank you so much.
You're
this
welcome.
has been a wealth of knowledge for a wealth of good, certainly. If you'd like to find out more about the Family Community Clinic and what it's doing in the community, you can log on to www.famcomclinic.org. Thank you once again for joining us for another edition of Heart of Gold.